Gastroscopy is a procedure to examine the inside of the esophagus, stomach, and duodenum using an endoscope. Here's a step-by-step explanation. 1. Preparation. Patient fasting. The patient must fast for about 6 to 8 hours before the procedure to ensure the stomach is empty. Medication review. The doctor checks if the patient is taking any medications that may interfere with the procedure, such as blood thinners. Consent. The patient provides informed consent after the doctor explains the procedure and possible risks. 2. Anesthesia and sedation. Local anesthetic. A local anesthetic spray is applied to numb the throat. Sedation. Some patients receive mild sedation through an intravenous line to help them relax, though it's possible to do the procedure without it. 3. Positioning the patient. Lying position. The patient lies on their left side on the examination table. Mouth guard. A mouth guard is placed to protect the endoscope and prevent the patient from biting it. 4. Insertion of the endoscope. Initial insertion. The doctor gently inserts the endoscope through the mouth, guiding it down the throat into the esophagus. Controlled breathing. The patient is encouraged to breathe slowly and deeply, which helps reduce gagging and relaxes the esophageal muscles. Chapter 5. Examination of the upper gastrointestinal GI tract. Viewing the esophagus, stomach, and duodenum. As the endoscope advances, the doctor examines the esophagus, stomach, and the first part of the small intestine, duodenum, for abnormalities like inflammation, ulcers, polyps, or tumors. Air insufflation. Air is often passed through the endoscope to expand the GI tract, which provides a clearer view of the internal lining. 6. Taking biopsies, if needed. Tissue sampling. If necessary, the doctor uses special tools passed through the endoscope to take small tissue samples, biopsies, for lab analysis. Polyp removal or treatment. In some cases, polyps or small lesions can be removed or treated during the procedure. 7. Completion of the procedure. Endoscope withdrawal. After examination and any necessary treatment, the endoscope is slowly withdrawn. Recovery. If sedation was used, the patient is monitored in a recovery area until it wears off, usually taking around 30 minutes to an hour. 8. Aftercare and results. Post-procedure instructions. Patients may experience a sore throat, bloating, or mild cramping, which typically resolves within a few hours. Results discussion. The doctor reviews the findings, discusses any further treatments if required, and arranges follow-up if necessary. Biopsy results may take a few days. Gastroscopy is generally safe and minimally invasive, but patients should be aware of rare complications like bleeding, infection, or perforation of the gastrointestinal tract.